Hello and welcome. Today we're diving into a rare and devastating neurological disorder called Alexander disease. This condition primarily affects the brain, particularly the white matter, and predominantly impacts children, though onset can occur at any age. Join us as we explore the complexities of Alexander disease, from its causes and symptoms to current treatments and ongoing research. Alexander disease is caused by mutations in the gene that provides instructions for making glial fibrillary acidic protein, or GAFAP. This protein is a major component of intermediate filaments and astrocytes, specialized cells that support and protect neurons in the brain. These mutations lead to the production of abnormal GFAP, which then clumps together to form structures called Rosenthal fibers. While not fully understood, it is believed that the accumulation of these Rosenthal fibers disrupts the normal function of astrocytes and interferes with the myelination process, the formation of the protective sheath around nerve fibers. The pathophysiology of Alexander disease centers around the accumulation of Rosenthal fibers, these abnormal protein clumps, primarily within astrocytes. These fibers disrupt the normal cellular processes of astrocytes, leading to a cascade of detrimental effects. Myelination, the process of forming the myelin sheath around nerve fibers, is significantly impaired, leading to slowed nerve impulse transmission. The white matter, which is composed of myelinated nerve fibers, becomes progressively damaged and dysfunctional. This widespread disruption of brain function underlies the diverse range of symptoms observed in individuals with Alexander disease. Alexander disease is an incredibly rare condition. While precise epidemiological data is limited, it's estimated to affect only a few hundred people worldwide. It is believed to affect males and females equally. Due to its rarity, diagnosis can be challenging, and the true prevalence may be underestimated. The signs and symptoms of Alexander disease are highly variable and depend largely on the age of onset and the specific type of the disease. In infantile onset, the most common and severe form, symptoms may include seizures, developmental delays, an abnormally enlarged head's macrocephaly, and progressive loss of motor skills. Juvenile onset Alexander disease can present with problems in coordination, speech difficulties, swallowing problems, and spasticity. Adult onset forms may involve progressive weakness, ataxia, lack of coordination, and bulbar symptoms affecting speech and swallowing. The range of symptoms highlights the widespread impact of the disease on neurological function. Diagnosing Alexander disease typically involves a combination of clinical evaluation, neuroimaging, and genetic testing. A thorough neurological examination is crucial to assess the individual's symptoms and developmental milestones. Magnetic resonance imaging, or MRI, of the brain can reveal characteristic abnormalities in the white matter, often with the presence of leukodystrophy, a degeneration of the white matter. However, the definitive diagnosis is confirmed through genetic testing to identify a mutation in the GFAP gene. Brain biopsy, while sometimes performed in the past, is less commonly used now due to the availability of genetic testing. While Alexander disease is primarily classified based on the age of onset, infantile, juvenile, and adult, some researchers also describe subtypes based on the specific symptoms and rate of progression. For example, there's a distinction between type I and type I infantile Alexander disease, with type I being the more severe and rapidly progressing form. Currently, there is no cure for Alexander disease, and treatment focuses on managing the symptoms and providing supportive care. This may include medications to control seizures, physical and occupational therapy to maintain motor function and prevent contractures, and speech therapy to address communication and swallowing difficulties. Nutritional support is also crucial to ensure adequate caloric intake and prevent malnutrition. In some cases, surgery may be considered to relieve hydrocephalus, a buildup of fluid in the brain. Ultimately, the goal of treatment is to improve the individual's quality of life and provide support for both the affected individual and their family. Since Alexander disease is caused by genetic mutations, there is currently no known way to prevent the disease itself. Genetic counseling is available for families with a history of Alexander disease to assess the risk of having a child with the condition. Prenatal testing may also be an option for couples who are known carriers of a GFAP gene mutation. The prognosis for individuals with Alexander disease varies significantly depending on the age of onset and the specific type of the disease. Infantile onset Alexander disease typically has the poorest prognosis, with many affected individuals surviving only into early childhood. Juvenile and adult onset forms may have a more prolonged course, but the disease is still progressive and ultimately leads to significant disability. Recent research efforts are focused on understanding the mechanisms of Rosenthal fiber formation and developing potential therapeutic strategies. Gene therapy approaches, aimed at correcting the underlying GFAP gene mutation, are showing promise in preclinical studies. Other research is exploring the use of pharmacological agents to reduce GFAP expression or promote the clearance of rosenthal fibers. While these advancements are still in early stages, they offer hope for future treatments that could significantly improve the lives of those affected by Alexander disease. Thank you for joining us in learning more about this complex and challenging disorder.